great job to everyone that pushed back HICPAC. There's at least 3 articles out now, and I'm going to talk about the one here in Forbes, where they mention our efforts to push back on the CDC's plan to weaken infection control guidelines. The Healthcare Infection Control Practices Advisory Committee, HICPAC, met in June and initially published slides outlining its draft guidelines, which suggested that N95 masks are no more protective than surgical masks, which we know is blatantly not true, and this recommended guideline would put workers and patients at increased risk by weakening infection control measures. Now, during this meeting, there was a public comment section where they cut us off after 41 minutes and only 14 speakers. First, we noted that aerosol transmission is not being addressed. N95 respirators offer clearly better protection than surgical masks. Additionally, it's absolutely absurd that the HICPAC committee did not give guidance for ventilation. So much so that the first speaker said that if I, a member of the public, can easily figure out how viral transmission works and how respirators and ventilation help, surely you can too. So clearly we need to recommend improved ventilation, UV disinfection measures, and the addition of HEPA filtration, which are essential for controlling an airborne pathogen. Additionally, HICPAC did nothing to address long COVID and the risks that we take with our health by getting infected with COVID, and that the CDC needs consistent messaging to educate the public around the true dangers of COVID and being disabled by long COVID. There was even a financial advisor there, Nathaniel Narode, who outlined that it's clearly better to buy a $40 respirator for each one of your staff than to face hundreds of millions of dollars in liability, you have disabled staff, and then face reputational damage because people will be avoiding your hospital since they are getting sick there because of your inadequate procedures. There are already people in the disability community that are choosing not to go to the hospital because, one, their Americans with Disabilities accommodation requests are not being respected, and these individuals risk being reinfected at these hospitals, endangering their health. So in their internal cost-benefit analysis, it is not beneficial to go to the hospital because nearly 20% of all COVID infections are healthcare-related, which reflects a failure of current infection control practices to protect people. And furthermore, this nosocomial or hospital-acquired COVID-19 is deadlier in the community because more vulnerable patients are affected at the hospital. And COVID still remains the 3rd leading cause of death, so updated guidance should be progressive, not regressive. And this is absolutely not contested. There's no evidence for HICPAC to have made the bad guidelines or the poor guidelines that they set out, as even the Environmental Protection Agency, the EPA, recognizes that COVID is spread through aerosolized particles, so standard precautions should involve universal, high-quality, well-fitted N95 masks. And remember, this is all after 900 public health experts, including myself, signed a letter to CDC Director Mandy Cohen expressing our serious concerns about the lack of transparency in this HICPAC process, the poor guidelines that have been released so far, and then having not been able to see a draft of these proposed guidelines. So now we're putting pressure on the CDC and you, CDC Director Mandy Cohen, because you need to do better.